Is everyone here to talk about acupuncture? Yes. We'll keep it quick because I know there's lots of fun stuff to buy outside. But I'm really excited to spend the next 20 minutes or so chatting with everyone about how acupuncture can be a support for companion animals. We'll talk just a little bit about Chinese herbs and some other Chinese medicine modalities that can help your companion animals as well. I'm Lisa Franzetta. I'm a licensed acupuncturist and herbalist and a doctor of acupuncture and integrative medicine. And I treat animals here at Marina Village Veterinary on Tuesdays and Thursdays. And just a show of hands, since we're talking about acupuncture, who here has had acupuncture before? Right. Any animal parents in here whose animals have had acupuncture before? Awesome. Good. And hopefully you've had some good experiences with that. All right, so let's start with some definitions. What is acupuncture? Acupuncture is the insertion of tiny sterile needles into strategic points on the body to create a healing effect. And here are, actually this cat is the late great Gus Franzetta, one of my babies, getting an acupuncture treatment, and another patient of mine. And you know, in Chinese medicine, we have a little bit of a different way of describing how the body works. We talk about meridians and qi. Maybe you've heard some of these terms. But just in very general terms, we say that disease in the body is caused by imbalances in the body. And the way that acupuncture works in Chinese medicine theory is by helping nudge the body back into a state of its natural balance. But, you know, people always ask me, okay, but how does acupuncture work? Like, how does it really work? So we can use what we know from modern biology and medicine to explain what's happening when acupuncture needles are inserted in the body. And there's a lot going on, really, and there's actually a lot of really interesting research about this ancient medicine that we can look at now through the light of modern science. So some of the things that we know that acupuncture does for animals and humans, we're animals, it stimulates the nerves, muscles, and connective tissue. It increases blood circulation, which is critical for vitality and health. It can relieve muscle spasms. It stimulates the release of neurotransmitters like endorphins and our body's natural painkillers. It can also kind of shift the body out of our sympathetic nervous system, which is that fight or flight state, into the parasympathetic state, which is the state in which the body can relax and also heal. And we need to be in that state to maximize healing ability. Acupuncture stimulates the production of cortisol, which helps control inflammation. And it modulates pain, stimulating pathways in the nervous system. So some of the first uses of acupuncture in animals in this country was actually for analgesia, specifically. This is also one of my cats. So this is just, we'll do like a super quick history of acupuncture for animals. So Chinese medicine is an ancient medicine. It's been around for at least 3,000 years. And the first references we have to acupuncture being used for animals date back to about 930 BC in China. And those references talked about the use of acupuncture with horses. Anyone want to venture a guess why they would have been concerned with keeping horses healthy in China in 930 BC?
Transportation. Or ag. Transportation.
And military, right? Horses were a really important part of the military in China at that time. So they brought the most powerful medicine that they had to try to keep their animals healthy. We didn't hear about acupuncture being used with dogs and cats at this time. That actually comes quite a bit later. But just to give a little context, the sort of the first beginnings of what looked like what we would now describe as Western veterinary medicine didn't really start until the 16th century, and the first Western Veterinary College opened in France in the 1700s. So that's just to give a little context, because I know sometimes people hear animal acupuncture and they think that's like some wacky thing that was invented in Berkeley in the 1960s. Right? But no, it's actually been around for thousands of years, and it's proven to be very safe and very effective. And so we're here today to talk about acupuncture for companion animals. And when that really started was here in the US in the 1970s. And that's when acupuncture as a profession in general was starting to be regulated. It was legal, starting to become legal to be an acupuncturist and practice medicine in that way in the US in the 1970s. And at that time, acupuncturists were starting to see like, oh, hey, how can we support non-human animals with this medicine? And there weren't many acupuncturists around at the time, so they started teaching veterinarians to practice this medicine with animals. We'll do a very quick sidebar about Chinese herbal medicine, because that's another Chinese medicine modality. It's another thing that we offer here at Marina Village Veterinary. Has anyone here used Chinese herbal medicine? Cool. And I'm also cooking up a Chinese herbal brew up front by the coffee. Don't miss it. That's for humans, not for animals. But Chinese herbalism is a little different from Western herbalism in that we typically won't prescribe just a single herb in Chinese medicine. Usually we'll prescribe herbal formulas where you'll have several herbs that are combined for a synergistic effect. And we talk a lot in Chinese medicine in general about treating the root cause of disease. So whether it's herbal medicine or acupuncture, we're never just looking at the symptoms that your animal is experiencing. We're looking at what is the underlying cause of those symptoms. So, if your animal's back hurt, we're not just prescribing a painkiller to relieve pain. We're also taking a look at what is the cause of that pain and how can we address that root cause while we're also treating the symptoms. And like everything in Chinese medicine, herbal medicine is very customized for individual animals. I should have started by saying, if anyone has any questions as we go, please just jump in and let me know. I'm going to try to leave a little time for Q&A at the end, but I know we're moving right along. So if you have questions, please just raise your hand, or I'm from New Jersey, so just interrupt me. I'm used to it. Okay, so another question I get asked a lot are, what are some of the common conditions that acupuncture can treat? And the answer is pretty much everything that you as a human might see an acupuncturist for is appropriate for bringing your animal in. And one of the things that's great about acupuncture and Chinese medicine is that we actually have really powerful tools for some conditions that Western medicine just doesn't have a lot to offer animals. I would say probably my most common patient, it tends to be like a senior animal who's starting to experience some limited mobility and pain because of arthritis and stiffness in the body. We know that statistically senior animals are very likely to have arthritis. So things like osteoarthritis, intervertebral disc disease, recovery from orthopedic injuries are really typical scenarios where I would be treating animals. But also acupuncture and Chinese medicine are really powerful for addressing internal medical issues as well. I have a 8-year-old cat who was recently diagnosed with early stage kidney disease. And so I'm starting to work with him to support his kidneys to try to prevent that from progressing further. And I'm hopeful we can turn it around. Time will tell. We'll talk next year. And I just wanted to note too that I think it's pretty well known that we're not great at preventative care in general in this society, for humans or for animals really. Usually it's like you show up at the emergency room when you're falling apart. But preventative care is really a cornerstone of Chinese medicine. And so I love it when someone brings a middle-aged, like pretty healthy animal in and says, you know, I want them to start getting support now so that they can age in the most healthful way possible. And I just wanted to share a quote with you from one of our classic texts of Chinese medicine, the Yellow Emperor's Classic, which is at least 2,000 years old. And it says, to administer medicines to diseases which have already developed and to suppress revolts which have already developed is comparable to the behavior of those persons who begin to dig a well after they have become thirsty. So that's to say, like, please, like, start thinking about how you can support your animals in this holistic way before they're falling apart, before they're in a lot of pain. And keeping in mind that animals are really good at disguising pain. So by the time that our animals are showing us behaviors indicating that they're in pain, they've probably been suffering in silence for a long time. And that's something that acupuncture can really kind of support them with as they get older. So we have an animal model here today. I don't know if she knows it yet, but I thought I'd kind of Miss Mabel over here in the corner, and I thought we could see if she's up for it. If we could just do like a little demonstration of treatment for Mabel. Let's see if we can. Think we can get her. I know it's exciting, so I don't know if she's going to be able to.
Her ex-dog walker may be a little distracting.
This guy. What do you think, Mabel? You want to get down on the ground with her? See if we can just get her to relax a little bit.
Anytime yours is like, yeah, not me. Not voluntary.
And so at your animals treatment, I was just in the Fear-Free talk next door, and we talked a lot about just making it a relaxing experience for your animals. So, in our acupuncture room here, we play music. Usually I'll have a mat on the floor for your dog, or if it's a cat, sort of depending on how your cat is going to be most comfortable. We just try to have kind of a nice spa vibe. I might have to ask you to leave, honestly. Is it just so exciting? At first, we'll spend some time talking about getting a whole picture of what's going on with your animal, because Chinese medicine is a holistic medicine. So even if, say, your animal is coming in because they hurt their back leg, I'm still going to ask questions about, like, how is their digestion? How do they sleep? What is their temperament like? Because all of those things inform the kind of treatment that your animal is going to get, because we're always thinking about individualized care. Oh, you're so good. So we'll typically, I'll start my appointments doing some Chinese body work, which is called Tui Na, and I will teach pet guardians to do Tui Na with their own animals in the course of the treatment, because that's a kind of therapy that you can do with your own animal between their acupuncture treatments to help with consistency of care. And then usually often animals, when they're distracted, like Mabel is right now, usually won't pay too much attention to me. I always like to have mom or dad in the room with them. And Mabel's just getting acupuncture right now, and she doesn't even know it. I don't know if you guys can see, but we're just doing a little low back support for her right now. Some dogs are really food motivated. I often think I could do like outpatient surgery on them while they have their face in a licky mat full of cheese, and they would be totally fine with it. But
how deep do you go? How deep do you go?
Usually, you silly. I have a couple different lengths of needles that I use. This one, you probably can't see it, but it's 30 millimeters long. And depending on the part of the body, I won't necessarily insert it all the way. In a more muscular area of the body, like Mabel's a bigger girl, so we can go, you know, a good ½ inch in with this needle into the muscle there. If we're treating areas, say, let's see if I can do another example. Oh, it's so exciting, like a point by the ankle, for example. There's not much there. I'm using a ½ inch needle, and I've just popped it in, basically enough so that it'll stay in. There's not a lot of meat there. And this is, you know, what a treatment can look like. And they don't need to lie still, motionless. Humans are exhausted usually when they show up at an acupuncturist's office, so they pass out on the table. But that's not what an animal's treatment has to look like.
Question?
Yeah.
What's the length of time that you would leave a needle in?
It depends, but typically I'll do about 20 minutes.
Oh, wow.
Yeah, and if they're wiggling around, they might fall out, you know, and depending on how long they've been in, I might reinsert them in the same spot, or we might do a few points, let her hang out for 5-10 minutes, do a few more points. One thing that I do want to note about acupuncture is that, you know, it's not a magic wand, it's medicine, and the benefit of acupuncture treatment is cumulative. So, you know, like antibiotics, you don't just take it once and you're better. Like physical therapy, you don't just do it once and you're miraculously healed. For chronic issues for animals, typically it could be 4, 6, maybe even 8 appointments before we see really significant improvement. And in general, I'm going to recommend that animals begin with a series of weekly treatments. If it's a more acute issue, 3 or 4 appointments might be enough to really resolve it. And then, you know, depending on what we're treating them for, if it's something like arthritis support for an older animal, then we'll talk about maintenance care after we've done an initial series, and that looks different for different animals. I have animals who come weekly for maintenance care because their guardians just see that that's how they thrive. I also have animals who come every 2 months for maintenance care, and they do fine on that schedule. So it really depends on the animal. It's very individualized, and everyone's different, so it's hard, you know, you can't know ahead of time exactly what the ideal treatment plan is going to be for an animal.
If you were basing on like preventative,
Yeah.
would that be even more spread out?
Like, what would a good schedule for preventative be? Yeah, like, let's give an example. Let's say you have a dachshund, which we know, if you're in the veterinary community, is like a prime candidate for intervertebral disc disease, right? So we really, this is a classic animal we really want to get in for preventative care, because the likelihood of them having some kind of catastrophic veterinary incident somewhere down the road is pretty high. If you just have a young, healthy dachshund, if you could get them in every 3 months, that would be terrific for preventative care. And then maybe more frequently as they get older. Anyone else have any other questions?
I have a question for you about seeing patients that don't respond, or it just doesn't seem to be the answer for them. And at what point do you give up, or do you say try something else, or this isn't working, or how does that look?
Yeah, it depends, I guess, is the answer to the question. You know, depending on the issue, if it's a more acute issue and I haven't seen any improvement in 4 treatments, then I might start to wonder if acupuncture maybe isn't going to resolve it on its own. You know, and because Chinese medicine is a holistic medicine, we are also thinking about what else could be going on. You know, I see some dogs who come in because they have chronic dermatitis issues. Well, if their dermatitis is largely a result of an allergy that they have to a food that they're eating, they could come in for acupuncture twice a week for 2 months. but it's not fully going to address the issue because we still have the root cause there, which is that trigger is happening. So if we see that something's not resolving, we're also going to take a step back and look and see what else is going on. But say in the case of like an injury or something, and this holds true for acupuncture with humans as well, depending on the degree of their injury, there are certainly going to be some cases where surgery is indicated because, say, a damage to a joint or something is severe enough that acupuncture alone isn't going to help resolve it. And we look at and we take an integrative approach in that case too. Is there imaging we can look at? So, or we might recommend at that point that you do some imaging if you don't have it already, so we can sort of apply an integrative lens to what's going on.
And that becomes part of the treatment plan.
Yeah, exactly.
Okay.
Has acupuncture changed much over the centuries, or is it still kind of the original stuff was found out so many years ago?
Yeah, I mean, the acupuncture, Chinese medicine and East Asian medicine is a huge medicine. It's not a monolith. There's Chinese medicine as practiced in China before Mao, and then it was there's a kind of Chinese medicine that was standardized by Mao in the 20th century, and then there's Korean lineages, there are Japanese lineages. So it was never monolithic. That said, sort of the principles underlying how it is done have held true through time, but then there have been modern innovations that have been applied to acupuncture. For instance, we'll sometimes do a kind of acupuncture called electroacupuncture, where a machine that is essentially similar, it's actually in many cases the same machine as like a TENS unit, if you're familiar with that. Will have leads that connect to acupuncture points, and that's a way of applying more stimulation to points, which can be beneficial in certain instances. So certainly there have been like modern innovations, but a lot of this underlying philosophy of it, let's say, is the same as it was 3,000 years ago. All right, I'm at time. Thank you, guys. Thank you, Mabel.
That's pretty good.
She did very good.